Hello, I'm Aldo Rinaldi. I'm consultant cardiologist at Guy's and St Thomas's Hospitals in London. Well, I think when we're thinking about using pacemakers in patients with syncope, and if we're talking about neurocardiogenic syncope, we really need to be aware that this should be something that should only be offered really in patients where there are no other options, because we have to weigh up the risks and the benefits of the treatment. I think it's very clear that in certain patients that pacing probably shouldn't be undertaken, especially in those that have a predominantly reduction in their blood pressure with tilt table testing. However, there are some patients, probably patients who develop symptoms more so in their middle to older age, that have significant episodes of syncope with documented asystole. And in those patients where there is a risk of harm to them, then pacing can be offered to them as a treatment. However, there are pros and cons to any treatment that is invasive. Well, as we mentioned, in patients where there's predominantly the response when they have syncope is that they have a fall in their blood pressure, a sort of vasodepressor type of effect, then these patients really are not going to be helped by implantation of pacemakers. So really in those patients you should think of other treatments, whether or not be drug-related treatments, because even if they receive pacing, it's unlikely to give them significant benefit. Pacing is an important decision to make often in young patients, and we have to be aware that often in these patients there may be an improvement in their symptoms without any treatment. So when we consider therapies that the patient's going to have to live with in the long term, we really have to be very careful in choosing which patients should have pacemakers implanted.